we are live. Hello, everyone. Thank you very much for tuning in to our webinar on how to be an effective in-district lobbyist. As a quick introduction, if you don't already know, my name is Sam Tracy. I'm director of the Connecticut Coalition to Regulate Marijuana, which you can check out at regulatect.org. We're the organization pushing for the legalization of marijuana, treating it like alcohol here in Connecticut this year. We're a coalition of many different community leaders and member organizations who have that common goal. So we're very happy to have you here today, and I'm very happy to be joined by two other people who are leading the fight for legalization here in Connecticut. Julie Camerata, who's the lobbyist with the coalition, and Paul Kirchberg from Connecticut NORML. So this is a guide to in-district lobbying for marijuana legalization. And we're going to be starting off with a legislative update and a quick tutorial on just how to lobby. That'll be led by Julie. Then Paul will be going into why we should tax and regulate. So essentially all of the reasons in favor of reform. Then I'm going to talk about responding to some common concerns that are brought up by opponents or skeptics of legalization. Then finally, we will be taking some questions from the audience. So you can submit those questions either directly on this live stream. There should be a little window to the right that you'd be able to type some questions in, or you can also comment on our Facebook page, send us a Facebook message, tweet at us, send us a direct message on Twitter. Just reach out. We'll be sure to find your question, and then we can address it at the end. So without further ado, Julie will be talking about a quick legislative update.
So the 2017 regular session of the General Assembly ended on June 7th. And we had a couple of bills that were considered that would tax and regulate marijuana like alcohol, but none of them made it out of the committee process, so they didn't make it to the floor for a vote. There was some debate on the House floor as well, but it did not get called for a vote. However, neither did a state budget. So we're well past the 90-day mark without a budget and into the next fiscal year. And the legislature is still actively dealing with that. Taxing and regulating marijuana like alcohol can still be passed as part of the state budget agreement this year. And it's unclear when a state budget agreement will be reached. Many proposals were made. Actually, I think we have over 10 budget proposals right now that have been made thus far. Two included marijuana legalization, and there was also a mini budget from the governor that was not called for a vote. So, you know, it's still very unclear. But what is clear is the longer that the state operates without a budget, the more pressure there will be on legislators to reach an agreement. And I think that's why we all agree that's why it's very important. It's a critical time now to reach out to your legislators and let them know that you support taxing and regulating marijuana like alcohol as part of the solution to the current state budget crisis. And in order to effectuate that, in order to get your message across, there will be a number of follow-up materials that are sent to you via email after this webinar, and also available on the Connecticut Coalition to Tax and Regulate Marijuana on our website. So please consult those materials, because really, one of the most important things to being a good lobbyist is being prepared and understanding your issue. And so you want to do what you can to make your arguments effective and concise. And you should understand that being an articulate and respectful advocate for a particular issue with your legislators, weighing issues is very, very effective. And you want to see this visit as one start of a conversation with your legislator that should continue on other issues that affect your community. So again, back to how to get yourself prepared, just be professional at every level of this. So research the issue with the materials we provided, research your legislator. Even if you know who they are, go to their website page and check out. Sometimes you'll see pictures of their family. You'll find out you're a member of club that they're a member of, and you'll find ways to begin a conversation with them. Prepare your talking, what the key issues are to you. Look through the issues, the materials we have available for you, and really focus in on a couple of issues that are very important to you, and perhaps highlight those and discuss those. Bring a copy of materials that we provide you, including, and put your name and address and contact information with a business card if you can, to leave behind after the meeting.
And just to butt in for a second,
Sure.
too, this is Sam. I do think, and we've talked about a lot before, that a big part of preparation is a professional appearance.
Yes.
And maybe once we take the slides back down, I can do a little further demonstration. But as many people maybe who watched our Facebook Live video a little while ago, you know that my beard can get incredibly long in between big public meetings, which I definitely prefer to do. But I do also recognize that, you know, maybe walking in with a giant beard to a meeting might look a little scraggly or unprofessional or something like that. So before a big meeting, before an event, I'll always trim it down to make sure it looks clean and professional, just because as a general rule, we really like to say that you should just dress like a legislator. People respond better to people that, you know, look and act kind of like them. And if that's the way that they're used to being addressed, that's the way that you can be most effective. So it's kind of the time that, you know, if you've got a suit, put it on, or some kind of equivalent, make sure that your hair is trimmed down, don't wear any hats or anything, and just look as professional as you can.
And shouldn't have to say it, but we will, don't smell of marijuana. Mm-hmm. That's a really bad message to leave.
Absolutely.
But along with that, I mean, it goes along with the second item on the slide, which is just be considerate, make an appointment, be on time for that appointment. Dress neatly in business attire, as Sam was talking about, or dressing like your legislator. And you can find that out by doing your research ahead of time and looking at their website. You know, when you do get your appointment or your discussion with your legislator, make sure you just do the kind things that you normally do in conversation. Thank your legislator for his or her time up front and their staff. They do have a lot of people trying to meet with them and a lot of issues to juggle. So you need to recognize that there's a lot of things going on and that it is kind of them to make the time for you, especially when there's a budget up for discussion. And do that at the beginning and the end of your meeting. Again, you want to present and discuss your position, be respectful in your tone and your delivery, and of the time, because they will be under time constraints, as you may be as well. And you may hear some things or discuss some things with which you disagree with your legislator. It's really important to be aware of that, aware of facial expressions. You know, I've been lobbying this issue now for this year in Connecticut, and I've gotten all sorts of reactions. And it was a learning curve even for me, you know, to recognize you hear some pretty crazy responses that you would consider crazy as to why folks are, you know, reticent about marijuana. Be respectful, try not to make faces, and offer to provide information when you hear some things that you don't believe. For example, that it's a gateway drug. We hear that a lot. We know we don't have proof of that, but it's a real common reaction. And then make sure you can, this is really critically important. I think this is probably the most important part of the meeting, is finding out where your legislator really stands. We need to, although you may have a really great conversation, it may just be a conversation. You need to ask directly, will you support taxing and regulating marijuana like alcohol in Connecticut? Whether that's saying if it was an independent bill in Connecticut. And B, which is a very distinctly different question, would you support taxing and regulating marijuana like alcohol in Connecticut as part of this year's budget solution? Those are two very distinctly different questions. We could talk all afternoon about that, but trust us, they're two different questions. And then make sure you send a follow-up email or note. Again, thanking them again before you leave, and their staff, and send a follow-up email or note, because it should be about building a relationship with your legislator, whether you agree or disagree. This could be a long-term relationship that works out well for both of you. So treat it as such.
Absolutely. So thank you so much, Julie. And if any of our viewers or listeners have any questions about the specific how to lobby side of things, feel free to just start sending those to us over on Facebook or Twitter, or right here on this YouTube page, and we'll get to those at the end of the presentation. And Paul Kirchberg from Connecticut Normal is going to guide us through it.
Thank you. So why should we tax and regulate marijuana like alcohol here in Connecticut? Marijuana prohibition has been just as ineffective, inefficient, and problematic as alcohol prohibition was in the 1920s and 30s. That's surely part of the reason why 63% of Connecticut voters have been tallied to believe that cannabis should be legal for adult consumption. You can see that marijuana in the recent years, you've seen marijuana as being far easier to obtain and is actually gaining large popularity, contradictory to the policies put in place for prohibition. We see that consumption of cannabis has increased while diminished alcohol consumption. Personal experience myself. The concern here is marijuana may or may not be good for everybody, but it should be an option. Benefits for this legalization should include the following. One is increasing the freedom as a constituent here in Connecticut. We have the option to consume alcohol. Alcohol may not be best for certain individuals. Other people can consume it without any issues or concerns. Just like you would have with cannabis. Cannabis may not be for everybody. It may not be your personal preference. However, it should be a right for any citizen of Connecticut or state resident to make a cognitive decision on what's best for them. Have it be medically or have it be recreationally. Another part of regulation is trying to diminish the effects of the illicit market here in Connecticut. You've heard of drug cartels across the nation taking advantage of some programs or not. Here in the state of Connecticut, what we would hope to do is that the legislators have not only the fiscal responsibility to assist us in this deficit issue, but also the moral obligation in correcting this prohibition that's been in place for 8 decades, which really hasn't benefited citizens of the United States. Currently, in regards to replacing the illicit market, if you regulate and you actually structure cannabis, marijuana, in a legal market, you now know you can restrict the age consumption. You can have fines and penalties in place for situations when minors are in possession of cannabis, or if there's a sale to a minor, just like you would have in alcohol. Additionally, you would have safety measures in place that you can ensure that the cannabis that you're consuming is what it is. And again, these are legal businesses that are actually trying to make a profit, like we would in any other market, on a product that unfortunately has been demonized and has negative thoughts geared towards it on baseless facts. So what can we do here? With the legalization here in the state of Connecticut, potentially with the tax and regulations, we're going to be generating an estimated 180 million in tax revenues in the first year here in the state. So what do we do with that if that were to happen? It's nice to have a $180 million surplus of a new revenue stream. It's great. However, it's important, just like it is to educate the youth on activity, on consuming, to be known that alcohol is not necessarily something that you can be consuming, but it's something that is taught to youth, which has a more impactful meaning overall in their life, with education starting at a young age. We have seen alcohol consumption and nicotine consumption in the recent years dramatically decrease. I believe it's up to 30% now as of recent polling, where you're actually seeing that through education, alcohol consumption in youth and teens, and nicotine as well, has vastly diminished. I would hope that with instituting a tax and regulation of cannabis, that we would have a set amount or percentage something that legislators can identify as being a funding for these educational programs, because we really honestly need to promote the positive effects of public health. Again, with public health, making sure that the cannabis is properly taken care of as it's being grown and cultivated, that there are no heavy metals, that there are no pesticides, that extractions are safe, that your containers are tamper-proof. The thing here is we shouldn't be afraid to have cannabis in our society, in our households, because when it comes down to it, it really is the adults in the house that need to be responsible for the use in their guardianship. Same approach that people take for cannabis and applied it to alcohol, or applied it to nicotine or pharmaceuticals, you would have an outrage on the abundance and ease of obtaining these substances. So keeping public health as a priority in this program or in this regulation, it should be paramount, not only for the fiscal benefits of it, but the moral obligations that we have. So going forward with the fiscal responsibility, boosting the economy, the estimates are approximately 180 million in the state of Connecticut within the first year of legalization. That can either be a low number or a high number depending on who you speak to, what experts. I would not be surprised if you actually see large revenues based on activities from Massachusetts, which the tax structure may be mimicked here as well.
I think that's a key issue, if I may interrupt for a second,
Please.
Paul. I think that's just the tax revenue. And I think that's what folks have been focusing on. But in the state of Connecticut right now, jobs are badly needed. Industry is
Correct.
badly needed. And this is going to lead taxing and regulating marijuana like alcohol is actually a really unique situation for all states that decide to do it, because all of that activity must be contained within the state's borders. That means that every job associated with growing, handling, selling, and regulating marijuana will be in-state Connecticut jobs. They can't be shipped out somewhere else. And so that economic stimulation, while it is not a direct tax remitted to the state, is an enormous boon for the economy. And it's something that we've seen in the other states that have legalized. So it's not just the state coffers. And I
Right.
hear you in what you're saying. Certainly the legislature should put a portion of that money. It's only good public policy to put a portion of that money, just like with alcohol and tobacco, toward education. And I think we would see them do that. But it's also important to remember that these are jobs for your neighbors, many of whom are in need of employment in Connecticut.
Correct, and it's not necessarily, it's not only jobs just being in the cultivation and distribution and policy of cannabis itself, but it's also ancillary businesses that people normally don't think about. Cannabis tech, cannabis testing. You have marketing. You have vast other industries that are now going to take this product and start implementing their experience and exposure to this and trying to bring it to mainstream.
Absolutely.
You're going to see a huge boost of funding and policy and different kind of little apps and integrations that come out about this as it's brought up to more everyday life and it's not being shunned. Moving forward, I wanted to talk about the advancing social justice. There has been statistics that have proven that minorities have been indirectly targeted more towards cannabis-related violations, for having being in possession, having being in sale. There's also the discussion of prisons for profit. That we have seen down south. all of this is actually all due to false statements and unproven facts. The biggest issue with cannabis is people say you don't know enough about it. Well, that's true. If we don't know, we don't have enough studies about it, then why is the government so restrictive in it? Studies that are coming out now are actually contradictory to the education that we had in the past. And I think in time, it's just going to, you're going to see some of these falsehoods start being corrected. And I think there is a moral obligation. So it saves state resources, and having police officers not worrying about cannabis smoking or consumption, they're actually working towards other important crimes and issues. Let's give everybody the best option, and give people the effective tools they need in order to do their job and move society forward.
Absolutely. And thank you very much, Paul. That was fantastic. And I do really like the point that you made of just, I think it gets lost in the shuffle so much because we're talking about money, because it's the state budget, but this is a social justice issue. I mean, there's the racial justice aspects of it, just the personal civil liberties. And as we'll get to in my next segment here, decriminalization is good, but it's definitely not enough when it comes to protecting people's civil rights. So for this next section, I will be talking about how to respond to some common concerns that may get brought up in these meetings, whether it's with staff or with the legislators. But before diving in, I'm going to just give a few examples of common questions and how to respond to them. But before that, I do just really want to emphasize that when you are responding to these concerns, as Julie said, you want to stay as professional as possible, as respectable as possible. Look at everyone as a potential ally. This is an issue where we've been gaining lots and lots of additional public support every year. So people are changing their minds, and people are much more likely to change their mind if they're met with, empathy and understanding rather than getting attacked or feeling defensive. So that is really important to always try to meet them where they are. So one of the first concerns here that we hear a lot is that alcohol already does plenty of damage in Connecticut. Why should we legalize another drug? The campaign in DC against legalization was called Two is Enough, referring to alcohol and tobacco, saying we shouldn't legalize what they call the third drug. But some easy responses to that. It is true that alcohol does lots and lots of damage in Connecticut, whether it's through alcoholism and chronic diseases, driving under the influence of alcohol and car accidents, and many other ways, even directly overdose. And that alcohol is a primary factor in countless deaths, according to the CDC, the Centers for Disease Control. That's a federal organization, but they have not recorded marijuana as a primary factor in any deaths. So it is true that marijuana is safer than alcohol in pretty much every important way. When talking about overdose, it's possible to fatally overdose after consuming too much alcohol. That's never happened in the history of humanity, to the best of our knowledge, with cannabis. If you're talking about addictive potential, alcohol is significantly more addictive than marijuana. If you're talking about impairment, which we'll get to with driving, it has also been concluded by study after study that alcohol is far more impairing than cannabis. And every objective study on marijuana has concluded that it's both less harmful than alcohol, both to the consumer, which is important, but society more broadly, because there are a lot of other bleed over effects from alcohol, including violence and other things like that. And what is important too is that 1 in 7 Connecticut residents already use marijuana each year. That's 479,000 people who have said that they used marijuana in the past year. And as Paul was explaining, regulations would help protect consumers. So taking that harm reduction approach is really important, that if 1 in 7 people are already consuming marijuana, we should try to make it as safe as possible. Another common concern that we get is the claim that marijuana is a gateway drug, and especially why would we want to legalize it during the opioid overdose crisis? So similar to the other question, there's already this other drug that's doing so much damage. Why should we add marijuana to that? And first of all, just addressing the gateway side of things, the gateway drug theory has been thoroughly debunked. Really, the tiny kernel of truth that people cling on to is that most heroin users, for example, have also started on marijuana. And that is true, but they also use alcohol, they also use tobacco here, and that's not really a causal link. If you look at the people who use marijuana compared to the people who use those other drugs, the vast majority of people who use marijuana never move on to any other drugs. About half of Americans admit to having tried marijuana, but less than 15% admit to having tried cocaine, and that's the second most popular illegal drug. So because of that, it's obvious that a majority of marijuana users never even move on to cocaine, let alone heroin or other drugs. And also, talking about the opiate crisis specifically, states with legal marijuana have seen an average of 25% fewer opioid overdose deaths than states where marijuana is still illegal. Part of this is because marijuana is a good treatment for chronic pain. That's one of the things that marijuana is most useful for. If you look to states that allow it, it is a large amount of the recommendations there, and it's also what opiates are typically prescribed for. And similar to marijuana being a safer alternative for recreational use compared to alcohol, it's a safer alternative for the treatment of chronic pain compared to opiates. But unfortunately, Connecticut doesn't even include chronic pain in its medical marijuana program. We're one of very few states that does not. Another question is, wouldn't legalizing marijuana increase use among youth? This kind of what about the children mentality. And that, of course, is very understandable. No one, whether you're in support of making marijuana legal or keeping it prohibited, no one is saying should be using marijuana. We care just as much about protecting young people as those who wish to keep marijuana illegal. So it's very good to emphasize this to lawmakers and not just brushing off this idea that, oh, marijuana is not so bad, so who cares if kids use it? That's not what we're trying to say. We want to make sure that kids aren't using it, and prohibition, as Paul said, is very bad at that. That's because drug dealers don't card. In a completely regulated market where we have state licensed facilities who are selling marijuana, businesses would be required to ask for proof of age, just like when you buy alcohol, and they would face severe penalties for selling marijuana to minors. That makes it actually, paradoxically, more difficult for kids to get their hands on marijuana after legalization because, as we all know, it's unfortunately incredibly easy for kids to access cannabis currently. And also research, study after study, has been showing that reforming marijuana laws, whether it's decriminalizing medical marijuana or regulating it like alcohol, that it doesn't increase teen marijuana use. We do have some really good numbers, and all of this will be in much more detail in the documents that we will both send out and include on our website, which you can check out for links to these studies that I'm referencing. But in Colorado, high schools, in surveys of high schoolers, they actually found that past month marijuana use has gone down. It's a slight decrease, but it's certainly not the huge increase that opponents were warning about. That so many of these high schoolers have actually ended up using less marijuana. And in Washington, there was a similar study, this one asking youth whether it was easy or very easy, somewhat easy, difficult or very difficult to find marijuana, to obtain it. And since legalization, there's actually been, again, a slight drop, a very slight one, but still a drop in comparison to these warnings of massive increases in youth stating that marijuana is easy to obtain. So as we eliminate the black market where there is no ID checking and we move sales behind regulated counters, it actually is better for youth and prevention. And another concern is about DUI. This one does get brought up a lot. Essentially, this idea, wouldn't treating marijuana like alcohol make our roads less safe? We already have so many alcohol-related DUIs. And of course, again, just like with youth marijuana use, we want to emphasize that we're not advocating for anyone using marijuana while driving or driving after using marijuana while they're still impaired. That's currently illegal to do, and it will remain illegal after marijuana is regulated and legal for adults to responsibly consume. Driving under the influence is not responsible. And it gets brought up a lot that there is no breathalyzer for marijuana. People say that we shouldn't legalize it until we actually have some way to test impairment in an objective way. And yes, it is true that there is no breathalyzer for marijuana, but at the same time, there's no breathalyzer for opiates or sleeping pills or just drowsiness or texting while driving, all things that can significantly increase your crash risk. And there's already field sobriety tests, which can be done by police officers to determine if a driver has diminished capacity. And drunk driving is much more likely to result in an accident than marijuana consumption. Again, we're not trying to say that it's completely safe to drive after using marijuana, but it is worth pointing out the comparison. A blood alcohol content of 0.08, so just barely illegal. If it was 0.07, it's legal still. That increases crash risk 11 times over. While multiple studies and meta studies that essentially look at all of these various studies that have been done have basically found that driving after using marijuana roughly doubles crash risk. So obviously doubling crash risk is a bad thing. That's about the added risk of texting while driving, but it's nothing compared to increasing crash risk 11 times over. So we should still have policies to prevent marijuana DUI, but when talking to legislators, it's important to remind them of this, because especially to people who say have never used marijuana, have not been around it very much, they assume that marijuana is significantly more impairing than alcohol just because they're used to alcohol and see it all the time, when in fact it's the other way around. And finally, we've already decriminalized marijuana and it's legal for medical use, so isn't that enough? And this is something that gets brought up a lot, but decrim and medical marijuana are not enough. Decrim, it was a good reform, but it's still illegal to possess over half an ounce. You can get arrested for having, 3/4 of an ounce of marijuana, which is allowed in many other decriminalized states. And more importantly to me, growing any number of plants, even if you're a registered medical marijuana patient, is still a felony. So a medical marijuana patient who can't afford their medicine, who's trying to grow a single plant in their own home, can still get arrested and convicted of a felony. And this is so bad that combined with a small number of dispensaries we have, Americans for Safe Access, which is a national advocacy group, gave Connecticut a D grade on their scorecards of states with their patient access to medical marijuana. So we really can do better. As I mentioned, we don't include chronic pain, and that's another way to improve. So making marijuana legal for all adults over 21 essentially makes it over the counter. So those people who have chronic pain and especially want to grow their own plants would be able to do so under legalization. Now, finally, that does wrap up the largest part of our presentation here. We're now going to move into audience questions. So Julie, would you like to take that when a staffer is being kind of wishy-washy about where the legislator stands?
Well, I think at that point you need to schedule an appointment. That's the best. Request an appointment, do so via phone call and follow up with an email. That's really the best way to find out what the answer is. And in a lot of cases, bringing those materials, again, that you'll be receiving and will also be posted on our website, and just leaving those behind and then saying, can I follow up with you? Because if this legislator has not made up his or her mind, there actually is, that's great news, because there's actually ability to be able to have a conversation there. And so take that opportunity and have the conversation.
And I'll just take this one real quick. And just similar to kind of the broader statement of why our current policies aren't enough. So just because someone can, say, obtain CBD oil, or just because you can become a registered marijuana patient, medical marijuana patient here in Connecticut, that's not enough yet. You're to grow any plants, you'll still be arrested if you have too much, which is absurd both from a medication standpoint, but then also from a recreational standpoint. People can have a wine cellar, and that's allowed. So it really shouldn't be prohibited from having more than a small personal amount for cannabis. And because of that, you should essentially, you can refer to that document that we have. We've got some more studies that maybe you can point them to show them why CRIM is not enough.
Try to have that meeting in the district. You don't necessarily have to go all the way out to Hartford. And that can sometimes help not only have that meeting sooner, but also to build that relationship, because again, that's the long-term goal.
Paul, do you want to take this one?
I don't necessarily know if we're going to have a direct impact. However, I do know legislators are aware that the impending legalization in Massachusetts will affect sales, potentially of medical sales here in the state of Connecticut with lower pricing.
Very true.
Again, technically, you're not allowed to cross state lines as a patient with cannabis. That is a violation in federal law. However, people take risks, and the likelihood that a threat of the federal government sitting on the state line to enforce that rule, that's somebody taking that risk. Don't necessarily condone that. However, that is an option that state legislators need to realize, that that is a lost financial revenue stream that we have.
Well, I think there's a couple issues here. There's with Massachusetts legalizing right over the border, any town or city that is along that border. We have this issue with gas prices, right, where people cross over.
Right.
Well, what that does is it actually puts additional pressure on those towns that are right on the border for enforcement, as well as any other towns that might be on the way for, say, consumers from New York, which is a very big population, which is about twice the demand of our, doubles our in-state demand.
Yeah.
So I think we have this additional pressure that frankly falls a lot on the cities and towns in the state of Connecticut, yet without a program and still having prohibition, it provides absolutely no revenue for relief. And not all those towns get those tickets and fees, get that money back. That ends up going into the state coffers and probably only mitigates the cost of the prosecution and just the law enforcement time. So I think there are indirect impacts of being over the border that are absolutely going to affect legislators in their communities, and they aren't quite aware of it yet. It'd be good to bring it up.
Right.
Yeah,
and I would be honest to say that with Massachusetts already legalizing grow operations in Mass, I would honestly be surprised that you haven't seen diminished activity at the dispensary level already seen and proven statistically.
Yeah, and I think one last point on the Massachusetts angle here as well. It's just important to remember they're moving along. They're in their regulations right now, and sales are at least supposedly just supposed to start in July 1st of 2018. So next summer, people in Connecticut are going to be able to drive over the border and purchase marijuana at a retail store. And this just reminds me personally so much of these debate over Sunday sales of alcohol. That was actually happening back when I was an intern at the state legislature. And it's one of those things that started off, it was the ban was in place for moral reasons originally. Then later on, it was just kind of justified by a lot of other like, oh, we don't really want to make a change for X reasons, jobs. But eventually, the pressure was just there. We were losing so much business. As Julie said, people would drive over in order to purchase alcohol, but then also spend their gas money there, do their grocery shopping there. There's a lot of other economic losses to Connecticut. And so if people are going to be driving over the border for marijuana, they're also going to be spending a lot of other money out of the state too. So Connecticut should at least, if we're going to have everyone able to purchase marijuana legally, but in a short drive, we should at least regulate it in our own state so we can make our own rules and give the benefits to Connecticut residents and have all of that job creation going to people in our own state.
Undoubtedly, as soon as you talk to your legislator and mention the word budget, you'll see their facial expression change. It's been very, very difficult. I think what makes this unique is the fact that it's not an up or down vote on marijuana. It's an up or down vote on the overall budget package. And that means that if marijuana legalization is in the budget, it has a better chance of passing than it does if you're asking for an up or down vote on marijuana directly, because that simply is just not as pressing an issue as this package. Some folks take exception to that and they say, well, we never should have done it, or we shouldn't do it just for that reason. I don't think it means that folks are doing it just for that reason. I think what it means is that we're getting the focus and attention that we need to get on this issue, and the kind of real serious discussion that I don't think, unfortunately, was afforded us in the committee process, and I don't think the legislature has really had at this point, And it forces them to have that conversation. And I think that's a good thing. And it's also, though, it's timely. So it's very critical that you start making those appointments and even going to office hours for your legislators. Most, if not all legislators have office hours. They list them on their website. Sign up for your legislators' updates by email. They'll come right in. They'll tell you what coffee shop or town library or where they'll be meeting for their office hours, and just go and talk to them about this. I think it's really important that we reach out now.
Absolutely. And just to drive Julie's point home, I mean, some kind of an adage that I like in politics is really just that showing up is half the battle. And the legislators have a lot to deal with right now. Their time is stretched thin. They've got a lot of demands. They're making some hard decisions about the budget. And they're only talking to a limited number of people. And if a handful of those people end up being advocates of marijuana legalization, they'll start feeling that pressure and start thinking, hey, maybe this actually isn't a crazy idea. Maybe what I was thinking previously about this being a non-starter was actually pretty unreasonable, and this could be a good path forward as part of the budget. And you can start planting those seeds in their mind, making sure that the more people that you're working with, you know, if you live in town and you've got multiple friends in town, you should coordinate with each other and try to get this pressure coming on from different angles. Because if we show up, if we make our case, that's more than many other issues are doing right now, and that will make it possible for us to pass this as part of the state budget this year. So this is a interesting opportunity. I've read the other day that Connecticut's one of only 2 states in the country without a budget right now.
Right.
So it's unfortunate that we're in that situation, but it's a unique opportunity to be continuing your advocacy, you know, into September or October, when normally we would have had to have it wrapped up by June this year.
Right.
So it is an exciting time to be an advocate, especially for those who are in school or something like that and are looking for some activism this fall semester.
Facebook, make sure you are friends on Facebook with your legislators. They do check them, and their aides are aware of them. And the other thing I wanted to mention was that one phone call or that one request for a meeting, basically in legislative translation, in legislative currency, that one person represents more people than are on a stack of what do they call petitions. That one person packs more, it has more impact than a whole stack full of petitions of signatures, or a whole box full of form letters that say the same thing. So don't underestimate your value in reaching out to your legislators and having the discussion.
I would say next to zero. Maybe we would have had a chance with a different presidential administration, but because of President Trump and the people he surrounded himself with, especially Attorney General Jeff Sessions, who is a staunch opponent of any sort of marijuana legalization, or any sort of reform, I should say, even decriminalization. Unfortunately, we're kind of taking some steps back at the federal level. But it does seem pretty clear that there are also certain states' rights advocates within the administration, which is great. So I do think that they are going to continue allowing states to move forward with their own reforms. So I think that is important. They're not going to be touching medical marijuana programs. So far, they haven't said anything about recreational marijuana programs and interfering with those. And the governors of all of the states that have already passed legalization are standing up and defending their state laws. So we have 8 states plus DC already. It would be great if we could add Connecticut to that. So the federal government, it is kind of a strange mix between allowing states to do their own thing. But as far as federal policy about the scheduling of marijuana or any sort of national legalization, unfortunately, that does not seem very likely in the near future. So thank you very much to everyone, and help us legalize marijuana in Connecticut in 2017.